Welcome to Visions for Health. I'm Dr. Wendie Trubow, co-founder and quality director at Visions Healthcare, with locations in both Wellesley and Dedham, Massachusetts. During the course of the show, we're going to be exploring the 5 core areas of health: your physical body, your biochemistry, emotional, energetic, and spiritual health. Today, I'm delighted to have Dr. Susan Corso on the show, who's going to be discussing spiritual health with me. Dr. Corso, thank you so much for being here.
My sincere pleasure, Wendy. Thank you for inviting me.
How'd you get here? How did you wind up on this path in life?
Oh, well, I've been an intuitive for 50 years, which means that when I was 5, something rather dramatic and amazing happened. So I forewarn your audience. My father was killed in a plane crash.
I'm sorry.
Yes, I miss him every day. And thank you for that. And in those days, next of kin didn't have to be notified. And so we heard that he was dead on the radio, in the car, on the way to the airport to go pick him up.
You were 5.
I was 5. I was in the car with my mother and my 2 younger brothers. My mother started to cry, nearly drove off the road. She pulled to one side and she said to me, like with her face in my face, "Mommy needs a police car." And she put me on the top of our white VW Bug, age 5. I closed my eyes, I put my fists in the air, and I said out loud, "I need a police car." And I opened them and there was a black and white right there. And I didn't know really what had happened, but I knew something had happened. My mother was hysterical. The cop helped her. We figured out what was going on. And my father was indeed dead. And it is not unusual for people who are intuitive to have a dramatic event like that sort of blow their intuition into awareness.
Did you find that experience outside of the fact that your dad had died? Did you find the experience of what had happened around the intuition shocking, upsetting, challenging, scary? Was it natural? Was it, how did it occur for you?
That's interesting. It seemed natural to me, but from then on, about every other sentence out of my mother's mouth to me was, "Shut up. Shut up."
She did not find this to be
She didn't enjoy
something that she liked.
No, my mom had a problem with it.
Why though? I mean, when you say that she's saying "shut up," intuition implies that you know things.
I did.
So you knew things you shouldn't?
I knew things, according to my mother, that I shouldn't. I knew who was going to die. I knew when the phone rang who it was going to be. I could pick up the phone and say, "Hi, Wendy." And in those days, there wasn't caller ID. I would know when someone was really sick. So a friend of my mom's would say, "Oh, I have to take, John to the doctor." And instantly I would know what was wrong, what was going on, if the person was going to be okay, if this was serious, if it was not.
As a child?
As a child.
You're saying you knew this when you were a little kid.
Right. Things that I shouldn't know. I mean, people who are 5 don't know what leukemia is, but I did. And this actually kind of takes me into what intuition is. In our world, when we pay tuition, we're paying for information. We're learning.
In tuition.
That's right. Right. A lot of parents with college-age kids are in tuition. But the actual experience of being an intuitive is having knowledge that comes from within with no reason for you to have the knowledge. Right.
Okay.
So if I were studying Chinese, I would have every reason to be able to speak Chinese, right? But I don't study Chinese, so I have no reason to speak Chinese. So if a Chinese word comes to me while I'm sitting with somebody, that's straight intuition. There's no, unless somehow I came across a Chinese word and learned it, but unusually. I think I know one word in Chinese, which is ping, which stands for peace. But
you would know that word.
That's exactly right. But so intuitively, my mother was way not interested in what I knew, and there's a reason, and it's because because human beings get wrapped up emotionally in negative things that happen, there's a lot more intense emotion around things that are quote unquote bad, you know, a terrorist attack, a hurricane, a dramatic, an accident. Dramatic events have a lot of negative emotion around them, as opposed to, oh, gee, beautiful flowers, it's a little mellower. So when it happened over and over, my great-grandmother, who also was an intuitive, and I think my grandmother was and my mother was as well, but they were not really interested in practicing it. But my great-grandmother said to me, come here, sugar, and explained how to begin to live with knowing.
How old was she when you were born?
When I was born, my great-grandmother was probably 70.
And how old was she, were you when she died?
I was 12. She was 82. Now, here's a story. This is interesting. My mother was devastated that her grandmother, my great-grandmother, was dying. And my great-grandmother was very ready to die. She was a teacher in a one-room schoolhouse. And she was very, very smart. She used to do crossword puzzles. She taught me how to do them. But she only did the acrosses or the downs.
You mean at the same time?
Yes.
Or in the puzzle?
Ever. She just figured out the rest intuitively. It was very fun, and she always did them in pen. Anyway, she was dying, and my mother was devastated, and her daughter, my grandmother, was devastated. Anyway, they went down the hall to get coffee or whatever, and I was left alone with my great-grandmother. And I looked at her, and she'd had a stroke, and she couldn't speak anymore. She could understand, but she couldn't speak, which is so frustrating for someone that bright. And I just looked at her, and I said to her, Grandma, I will take care of them. Go. It's fine. And she looked at me. It was amazing. One tear fell down her face, and she died that night. She was an awesome human being, and she taught me how to use my intuition to help people heal. And that's, I think, the beginning of what ended up to be a career, although I didn't start out doing this.
When you talk about bad energy or bad things happening, was there a point at which you shut that down?
Yes, and I tried really, really hard for 20 years to just say, oh, I don't need to know this, I don't want to know this, but I would know anyway, and it was like having a battle in my own head, and I am not a clairvoyant. So now what's the
difference?
Okay, so there are subtleties. There are three sort of ways that intuitives access information. A clairvoyant sees visions, a clairaudient hears voices, and a clairsentient has a sensation in their bodies.
And how do you...
I'm much more of a clairaudient and a clairsentient. If I have a vision, it's very rare. I mean, once in every maybe 3 years. Do I have an actual vision of something that's happening? Although I have to say, as I've gotten older and more of my own family have died, I am much more in tune to other people who have guardian spirits with them or grandparents or whatever, and I can sense them than I did when I was a kid. I didn't have a connection to that when I was a kid.
Do you feel your intuition in a particular place in your body, or does it occur all over?
It occurs all over, but for the most part, intuition for me, I feel in a specific place in my brain.
Where?
On the right-hand side, just above the occipital, sort of like maybe, I don't know what.
I mean, are we talking like in between your ear and the back of your head?
Yes. Yes.
I'd show you the back of my hair, but then that's just wrong.
Right, but where it's a physical sensation in my brain when it's intuitive knowledge as opposed to something that I've learned, as opposed to something that I fear. And very interesting, when people are intuitive, they still are human. I'm still a human being with my own life experiences, my own filters, my own emotions, my own doubts, fears, worries, guilts, joys, blessings, you know. So I have to filter out what's mine versus what's intuitive.
But this sounds like it's really challenging because it's very easy for us to go along and just be doing our thing and not necessarily separate that that's my feeling versus that's a knowing versus, you know, my stuff versus no. That's really challenging, Suze, I would think.
Well, my great-grandmother taught me, because I learned the hard way, because I would be in school, you know, 2nd grade, and say, you know, well, when you go home today, you tell your brother he better be careful crossing the street or else he's going to get in trouble. Because I would know. And then the little brother would get hit by a car.
Ugh.
It was awful. How do I shut down that knowing? And okay, so now here's my humanity showing all over television. At the same time as I liked knowing.
Sure.
Right? Because I'm an A student and I'm a smart kid and I loved studying and I loved knowing stuff. That was fun and there was power in that. But it finally wasn't until I was in my late 20s that I understood that I could really turn this off. This is a funny story. When I was younger, when I would get my period, I would see auras around people and human energy, and I can explain that in a minute, but every human being has an energy field, and some of us see it and some of us don't. Well, around the time of my period, it was worse and worse and worse and worse. So one day,
better and better.
Well, depending on how you wanted to look at it, right? So one day, it was really, really hot in the summertime. I was living in New York, and I was walking home from work, and I was feeling really crummy. I had bad cramps, and I decided I was going to look down at the sidewalk so that I wouldn't have to see people's auras, right? Then I started to see auras around their feet. And I stood on the corner of 52nd Street and Madison Avenue, and I said out loud, like all the crazies, "That's enough!" And they went away for the first time in my life.
The auras.
Yes, the human energy. And I didn't understand what had happened. I didn't see one more aura all the way home. I walked all the way across the island of Manhattan to the west side where I lived in Midtown, cranked the air conditioning, took a shower, fixed myself some dinner, and went into kind of meditation and said, "Excuse me, what just happened?" And
so you hadn't known you could turn it off?
That's right.
You had always just been the recipient of
that's right.
all this information.
That's right.
How did you, I mean, I personally don't like to go to the mall at Christmas time because everybody's so frenetic and like crazed and parking and deals.
Yeah.
So what you're describing sort of is my experience of Christmas in the mall. Is this what it was like?
All the time.
So how did you protect yourself? I mean, I just don't go to the mall at Christmas. Right. That's my way.
Right.
But if that's your everyday experience, how do you dance?
School assemblies were nightmares for me. Going to a big supermarket, like there wasn't this when I was a kid, but like a big Walmart now. That was hell for me. And so what I learned to do was shut out everything.
Were you a child who was insular? Did you read a lot?
I read a lot.
Did you have a lot of friends? Were you more solitary?
I was much more solitary. I had strabismus when I was a child, which is eyes that work separately instead of together. So
you really did see everything.
I really did. I saw 2 of everything. And until I was 7, everybody thought I was clumsy because I couldn't tell what was the real glass of milk and what was the fake glass of milk. So 50% of the time I knocked it over, right? Finally, I had a teacher catch me in class reading the blackboard with an eye closed. And everybody thought that I was, doing Popeye the Sailor Man and being cute, right? And I said to the teacher, no, otherwise there are two of everything. And this is one of those things, and it's the same for my intuition, actually. Why would it ever dawn on me to ask you if you saw 1 or 2 of everything? I simply assumed that everybody saw what I saw, right? Mm-hmm. I assumed that everybody was intuitive until my mother kept telling me to shut up. right? So my great-grandmother would say to me, come here. And she'd explain to me, okay, this is what you do. This is how you turn it off. This is how you, and I never could completely turn it off, but I could.
It's like mute on the volume.
Or it was like having a ticker tape that would go, sort of like a quiet radio on the back, in the back, but I didn't have to have it front and center and pay attention to it that way. And I just thought it was something that I had to suffer with. I didn't think that it was a good thing. I didn't think it was a gift. I didn't think it was a yummy. I thought it was. I embarrassed my mother like crazy. And for as long as I could ignore it, I did. So I was 25.
But let's back up. 12 to 25, ignoring.
Working on it, making it go away, getting it whooped upside the head sometimes because I would know what was going to happen, and it was scary. When I was 18, I was in a place with a bunch of kids that belonged to friends of my parents, and I looked at this one boy and I thought, oh God, he's going to be killed in a motorcycle accident. I knew it as sure as I'm sitting across from you. What do you do when you're, what was I supposed to do with that information?
What do you do with that information?
Well, it made me a pretty spiritual kid. I learned to pray. I learned to ask, what do I do? Do I say this to somebody? Do I tell somebody? Do I not?
And whom do you tell? Because I'm assuming if you told your mom, she'd be
shut up.
Not right. Don't tell me that.
Right? I don't want to know that. What I learned to do was I learned to ask, is this mine to know, or is this mine to know and tell? Sometimes there are things we just need to know, and we don't need to know and tell. I would say of 100 times of knowing, I maybe needed to tell once.
How old were you when you distinguished the need to know versus need to know and tell?
15 maybe? Because I kept getting in trouble, and I couldn't understand why people didn't want to know what I knew. Mm-hmm. And of course they didn't want to know what I knew. Goodness gracious, sometimes even I don't want to know what I know. Sometimes I have to say, okay, that's enough. You know, I need to watch Bones and do nothing, right? I need to read a novel. Because when you are a person who, like me, deals with people's problems day in and day out, sometimes you need a break. Sometimes you got to stop and just go, whoa.
So how do you get a break?
Is
there something you do?
Yes, I read. I do jigsaw puzzles because they're zen. I can focus. I can concentrate. I say a mantra over and over. I use my breath. I breathe in, peace in me. I breathe out, peace in the world. So I'm doing peace for the world. If it's a really good novel, I can get in there, or if I write, I'm really focused on it. Mm-hmm. If I'm working with someone, I'm not listening for myself or what else is going on in the world. Example here, the marathon. This past marathon in Boston. Yeah. A devastating experience, right? Did I have any idea that anything was odd? No, except that 3 people asked me if I wanted to go and be at the finish line, and long before this happened, and every single time, my whole body went, no. No, so that didn't make any sense to me. I didn't understand why. So did I have an inkling that there were going to be bombers? No, not at all. And on some level, I had a clairsentient response to what was coming, right? No. I can't always distinguish what that is. Now, if somebody had said to me, okay, why are you feeling that? But I don't even ask that anymore because sometimes I just get weird feelings.
And there's, I would imagine, so much coming towards you in the world that it's probably easier just to say, no, I don't want to be at the finish line.
Right, right.
Than
Say,
to explore
no,
that.
I think I'll watch that on television.
Especially because what would you do with that? If it's yours to know and it's yours to share,
Right.
what are you sharing?
Right.
And there's not specific.
Right, and I'm not interested in being a Cassandra and actually knowing and having to be disbelieved. You know, the prophetess that isn't believed in Greek mythology. No, no, no. Okay. So, finally, I have, at now 55, I say, look, if I need to know, let me know. And if I don't want to know.
Let it be white noise.
Yeah, let it. If I need to be a messenger that can make a difference in somebody's life, yes, please let me know. But otherwise, no.
So let's go back, because you said, I kept interrupting you when you were trying to tell me what happened when you were 25.
Okay, so when I was 25, a friend of mine gave me a psychic reading for my birthday as a present. Right?
You have interesting friends.
I do.
No one's ever given me that as a present.
Okay. Well, you know, that wonderful blessing and curse, may you live in interesting times. I have always lived in interesting times. So I went to go meet this woman on Morton Street in New York City. She knew only my first name. I walked through her door and she said to me, "Oh my God, you should be reading for me. You're much more intuitive than I am." And all the shuddering that my great-grandmother had done and all the shut-ups from my mother just blew out of my head. They were gone. Gone. And my intuition was wide open. And it was time to know what I knew and to go forward in that knowing. It was really spooky when it first happened. But then I started to teach people about living a life based on spiritual principles. By that I mean, well, if you're raised Christian, you would be told the golden rule, you know, do unto others as you would have others do unto you. If you're raised Jewish, you're told do not do unto others as you would not have others do unto you. It's the same rule, it's just in reverse. And there are equivalents to that in every single spiritual discipline in the world. It doesn't matter where you want to look. You know, Hinduism, Jainism, Taoism, native practices, shamanistic practices.
It sounds like you've studied a lot of the religions.
All of them.
Is that part of the divinity teaching in your Doctor of Divinity that you got, that you studied religions, or is this sort of a corollary that it was
both.
Part of interest?
It's both. It's my interest, and it's also that I am unwilling to let language, simply language, be a barrier to talking about important things, right? So if you had to agree with me in order to come and work with me, what a waste, right? I don't care. If you're a Hindu, I'm going to talk to you about Shiva and Lakshmi. And if you're a Buddhist, I'm going to talk to you about the Buddha. And if you're a Catholic, I'm going to talk to you about the Blessed Mother. It doesn't matter to me. It doesn't matter to me what form it comes in. What matters to me is that you have a connection to understanding that you belong to a greater order than just you.
Whatever you call it.
Whatever you call it. It doesn't matter to me. I say to people all the time, you know, on this planet, the sun always comes up in the east, right? You've never been anywhere on Earth where the sun hasn't come up in the east. When Mama and Papa Panda decide to have a hot time on a Saturday night, they don't make a giraffe. That's order, right? And that can be counted upon.
Yes.
All pandas make baby pandas. That's just the way it works.
If they make a baby.
If they make a baby.
They make a baby panda.
That's exactly right. So that works for me in terms of order. It doesn't really matter to me, even if people want to work with me who are atheists, that's fine with me. They're agnostic, that's fine with me. As long as we can agree on some kind of vocabulary. So there are people who say to me, you know, I totally get that there's something wonderful and magical about nature. I can call it nature, I don't care. I can call it God. I can call it Hashem if you're an Orthodox Jew. I can call it Buddha if you're a Buddhist. Doesn't matter. And I don't think it cares what we call it as long as we call it, is kind of my experience. So that's why I went looking into all the different religious vocabularies so that no one ever feels shut out by having to agree with me.
Got it. With your language.
Yeah.
Got it.
My personal path is mine. Yours is yours. Please let us find where they are parallel and help one another.
So let's go back to when you were 25. You hadn't previously been. When did you become a doctor of divinity? I don't think I've ever asked you that.
I got my doctorate in 1993, and I was ordained a minister in 1992.
So we're talking 20 years ago.
Yes.
So you were already in your 30s.
Yes.
In your 20s, when the floodgates opened, what happened?
Oh, well, I started to teach people how to live a spiritual life. And one day somebody called me and said, I don't want to take your class. I said, okay, don't take my class. She said, no, you don't get it. I want to come to your house for 2 hours and talk to you and pay you for your time. I was 25. I said, okay. Like, not quite knowing what that was about. So it turns out that she was in the middle of a terrible divorce. She needed help creating a conscious, kind custody arrangement for their son, who was a tween, that didn't tear the kid apart, or either one of them. Mm-hmm. And they lived 1,500 miles apart. Mm-hmm. So the kid couldn't go back and forth by himself. It just needed to be figured out, and she could not wrap her head around it. So she came and she told me stories about her son and about her ex, soon-to-be ex, and their marriage. And I listened to her, and I listened to the intuition in me, and we came up with a plan. She paid me $70, which was a lot of money in those days, which 10 times, give you a reality check, 10 times the amount of minimum wage in those days.
That was a lot of money.
That was a lot of money. And the next day, my phone rang. This woman said to me, hi, Sally felt a lot better when she left yesterday. Can I come today? I said, what? Okay. So suddenly I had a practice, and people started talking about go see Susan Corso, although I wasn't Susan Corso in those days. I had a different last name. And then I started to realize that my great-grandmother had taught me a whole lot more than I ever understood at the time.
Why?
Because a friend of mine named Michael called me one day and said, hi, I have a sore throat. I said, hi, what are you doing with a sore throat? He said, I don't know, but I have, and this was true, he said, I have a national commercial audition. He had a commercial, an audition for a national commercial. Well, in the acting world, an audition for a national commercial literally pays for your life for like 5 years and buys you an apartment. And like if you get a McDonald's ad, you're doing really good, right? But he couldn't do it with a sore throat.
How ironic.
And he said, I'm coming down. You're going to heal it. Click on the phone. I was like, oh my God, now what do I do? Michael comes. I don't know what to do. I pray. I say, okay, help me do this. I don't know how to do this. I put my hands on his throat. He felt a lot better. He left. He got the national commercial, which was amazing. It did pay for his life. He paid
for your apartment for a year.
He did not pay for my apartment. He bought himself an apartment. And he's a playwright, so he wrote plays for 5 years. But I had a sore throat for 5 days.
Ha.
And I went, huh. So then, a young dancer, she was 14, had knees swollen like this, just dreadful. She was so angry and hurt and upset. She could barely get to my apartment. Her teacher, I guess, brought her, carried her into my apartment, said, can you fix these? No one's been able to help her, not an orthopedist, not a blah, blah, fancy schmancy, blah, blah. I looked at this kid, her name was Stephanie, and I said to her, what are you mad about? And for 25 minutes, this kid told me.
The cab driver who
What?
told you how they are.
That's right. What she was mad about. She was angry about this and about school and about her dance teachers and about her parents and about her younger sister and her younger brother and the dog. I mean, she was mad about absolutely everything. And I swear to you, I sat next to her with my hands on her knees as she told me the story, and her knees returned to normal.
Was it your intuition that had you ask what she was mad about?
It was an instant prompt. Now, it's important that you understand that swollen knees does not always mean you're mad, right?
It's not a one-to-one.
No, because knees swell for all kinds of reasons, right? The issue is, what reason is it for that particular person, right?
So one size does not fit all, one size fits you.
That's right.
Got it.
That's right. Which is why, well, I say this to the docs I work with all the time. This is one of my favorite things. That's why they practice. They don't perfect medicine, right? Right. I practice medical intuition. It's a practice, not a perfect, right? So I could see 15 people with Lyme disease. Now, everybody knows that Lyme disease comes from a tick bite. Where did that tick bite happen? I don't mean where, like what forest. I mean where
on your body?
On your body. Because that's going to be the initial cue for me to ask the right questions to help you do the psychospiritual part of the work that helps you heal Lyme disease.
So let's transition, because I think that I've asked you a lot about yourself. Let's transition into how do you do a spiritual practice? How does it affect health? And how do you tie the two together? You work at Visions Healthcare. There's tons of providers. You work with doctors, you work with nutritionists, you work with energy people, yoga, chiropractors, acupuncture.
Osteopaths.
So how do you tie it in?
I don't. It ties itself in because every symptom has a psychospiritual aspect to it. Now, most people would know that word as in psychosomatic, right? Psyche is your mental construction, and soma means body, right? So a psychosomatic reason for a symptom, right? So let's just say, somebody comes to me with every single problem that they have is on the right side of their body. Okay, they have tennis elbow on the right side of their body, they have carpal tunnel syndrome, and they have sciatica. Now, everybody knows that tennis elbow, carpal tunnel, and sciatica are three separate things. In my reality, they're not. That's one thing. There are three symptoms. And one of the coolest things in the whole wide world, on this planet anyway, is bodies. And the reason is because, A, bodies are fascinating, no two alike, although the template's the same. And B, bodies don't lie. Bodies can't lie, right?
Okay.
All you have to know is if you've ever had an upset stomach. If you have an upset stomach, your body's telling you you have an upset stomach, right?
Yes.
If you need to get rid of whatever you ate, your body's going to do it. One way or the other, right?
One way or the other. That's really literal.
That's exactly right. Your body is going to say, okay, this is not working for me. Next, right? Somebody who, let's say, has all these symptoms on the right side, I'm going to say to that person, okay, you have aches and pains on the right side of your body. Carpal tunnel syndrome is a muscular problem. It's a repetitive stress injury, right? Tennis elbow, also a stress injury, right? Sciatica can be a stress injury. What's happening there? Why is it all on the right side of somebody's body? Well, on the right side of somebody's body, I'm going to look for relationships with male people in that person's life.
So if it were on the left, you'd look for female, and if it's on the right, you're looking for male?
So I would say to
Why?
you, well, because the right side of the body is, and 90% of people are right-handed, is the take action, go get 'em, do it energy in life, right? Dynamic. The left side of the body is magnetic, yin, receptive, holding still, allowing things to come to you. magnetic.
And you're a lefty.
Totally a lefty. This one's good for jewelry. Truly. Truly. So, and you're a lefty.
I am.
That's right. So left-handed people know a little bit more about going back and forth in the brain. We have to, because the whole world is right-handed.
Yes.
Right? I mean, you can't.
I can't even find things to cook with.
That's right. You can't open a door. You can't open a refrigerator unless it's thought out. In my house, you never ever see a coffee mug without an image on both sides, because I want to see the image too. One of those. So, the right side of the body, I would say, okay, a parent, a sibling, a spouse, a coach, a priest, an authority figure, some male energy is causing you to pay attention, or if it was a woman, your inner male energy. Jung talked about this. Everyone has an animus, a woman an animus, a male an anima, the inner feminine, right? Is trying to get your attention. So I would say, all right, is someone doing something to you that's upsetting you and making you hurt yourself, or is there something you want to do that you're not doing, right? 90 times out of 100, it's something they want to do that they're not doing, right?
So the thing that they would regret not doing later is the
right.
thing that's causing them pain now?
Because they're trying to draw attention to themselves. Do it. Their body is coaching their spirit. Their body is saying, do it. Go for it. Do it. It doesn't matter what it is. It doesn't matter if you can make money doing it. Do it and see what happens, right? 90% of people that I see need permission.
Permission.
A lot of human beings need permission. To know what they know.
To do or not do?
To do or not do. To know what they know, you know. I have people come to me all the time. I coach them how to learn to think about things in their own life. Most people don't understand that thoughts create feelings. Because
Thoughts do a lot.
Well, because it happens so fast, right? You're not even aware of the thought. You're just aware of feeling bad, let's say, right? Mm-hmm. You walk into a room and people have been fighting in the room, right? Everybody has that kind of sensitivity to energy, whether you call yourself an intuitive or not. You know, you can go, ooh, okay, want to get out of here, right?
Awkward.
Right, awkward, uncomfortable. All right, let's do something different, you know? So, if we can look at the body as a map, right? It actually not only is a map, but it's also the territory. And I tease out intuitively what's really going on. Why are all the troubles on the right-hand side? Or why are you consistently spraining that ankle? Why have you sprained that ankle 3 times? Yeah. Like, what is going on with that? Or, and I say this to physicians all the time, and they say to me, God, Susan, who do we send to you? And this is my highly technical medical term. I always say, send me the people with the skittery symptoms. And they go, what? I go, yeah, okay, high-tech medicine. It's the symptoms that move. 1 week, a person has a sty, and the next week a person has a toothache, and the next week the person has TMJ, and the next week the person has a rash. Whoa, whoa, whoa. That's one problem. That's one problem that's manifesting in movable symptoms.
Got it. So you're looking for tying it together.
That's right. I'm looking to create a meaningful narrative so that, because you know what, human beings don't like not knowing why. In fact, we like knowing why. And doctors, bless their hearts, doctors are amazing. And why is actually not always within the purview of medicine.
That was actually, I remember in medical school, it was uncool to ask why. Because most of the time we didn't have an answer. It was sort of, well, don't, you know how your mom used to say, shut up.
Right.
It was never spoken, but it was, don't ask that question.
Right.
Don't ask why. So
right.
I get that completely. It's not popular to ask why.
It isn't.
Or it wasn't, at least.
And yet, people, once they know why, a lot of times find the ability within themselves to change. where if they don't have a meaningful narrative, why did this happen this way, we go into this, that's not fair, that's not right, and we get stuck in an emotional or childish, actually, I'll claim that for myself, that's not fair. Well, okay, not
like
fair.
My 7-year-old.
Right, not fair in my reality means I didn't get what I wanted. Oh, well, right, that happens all the time. And I'm 55, so I'm kind of used to it, right? Often, though, I do get what I want because I ask for it, right? Because I say, no, that's not going to work for me. Let's do it this way, Yes. So this happened the other day. I had a patient come to me and say to me, oh my God, I just got the results of my allergy tests and I'm never going to be able to eat cheese again. And I said, never? She said, no, I'll never have pizza as long as I live. So we had a big dramatic moment, right? And I burst out laughing and said, okay, wait a minute. Never so long time
Yes.
when it comes to the soul.
Yes.
And that might be true for the next 30 days or 60 days or 90 days or 180 days. But if you will add the following 2 words to your sentence and take out the word never, you'll be able to do it. And people are like, what? What are you going to tell me?
Magic words. What
Right,
words are these?
Words. For
Abracadabra?
now.
Is
Right.
that 2 words?
For now.
For now.
I can't eat cheese for now.
Mm-hmm. It's funny you say that because whenever my kids say I can't do that, I can't do a cartwheel or I can't write in cursive, I say yet.
That's right.
That's right. Do that yet.
Well, funny, I had a patient come not long ago who has twins. And she said,
God love her.
That's right, at a year and a half. And she said to me,
God love her more.
I only have 90 minutes in the morning to bathe them and dress them and play with them. And I said, take the word only out of your sentence. I get to have 90 minutes every day to play with them and dress them and bathe them. She had plenty of time. Literally, how do we think about this? Take the word only out, add get to, right? No, not never have cheese again, right? It's like when people are diagnosed with diabetes and the conventional wisdom, it's a common thing that is said to them, well, you can eat sugar 1 day a year.
You mean a tablespoon of sugar? I
mean, no, it's like a piece of birthday cake, right? 1 day a year. And I go, yeah, okay. So that's not somebody who's living with diabetes who's saying that to you. That's somebody who's living with the theory of diabetes, right. Different reality, right? Because if you actually are going to read the labels on anything that you buy in the grocery store, 90% of what you're buying has sugar in it. So yes. That's not true. So unless you're only buying vegetables or meat, you're going to eat sugar. So yes. The question is not, can you eat sugar? Like, do I recommend candy bars as a normal diet for diabetes? No.
Snickers does satisfy,
right.
But not your diabetes doctor.
No. However, is there a way to learn to do this and manage it so that it has a meaningful narrative for you and you can sustain it? Of course. Of course. It's one of the things I love about the doctors at Visions. They're in health for the long haul. These are people who truly understand that healing is part of health and that the process of healing matters. This is not, okay, poof, we're going to fix you. Because we aren't in the fixing business. We're in the showing up for you business. And that's one of the things I say to the people who come and talk to me all the time is, don't do this alone. I give them my home office phone number. I say, okay, you're stuck, you're weird, you're freaked out, you're scared, you don't know what to do. Don't do this alone. You call me. You call me, you tell me when I can find you and a phone number, and I will call you back. Probably 1 in 50 patients does, but the one that does understands that they can feel taken care of. They feel that they matter. I mean, that's why Visions works for me, because Visions cares. My work is to care for people in their spiritual process, whatever that is. And that includes, for anyone I've ever had, having a body. I don't have clients who have no bodies.
We don't have paying clients without bodies.
No, I don't have paying clients without bodies. That's true.
Spirits don't pay.
That's true. But people who come to work with me are people who are frustrated about their health. They're frustrated that they're 15 pounds overweight and they're not getting rid of it. They're frustrated that they're continuing to smoke, knowing full well that they don't want to. Take it from somebody who smoked for 29 years. I quit. Took me a long time, but I did it, right? I'm a human, you know? So what I'm able to do is put together things that most people don't put together, because I don't live your life. I don't brush your teeth. So you come to see me and you tell me a story about your daughter and the cat and your mother-in-law and how you're gonna smack your husband upside the head when he gets home. And I hear that as one story. You had 4 experiences. But I'm not hearing it as 4 experiences. I'm listening for intuition to tell me, how are these things related, right? So in point of fact, in a scenario like that, this happens to me with with mothers with young children all the time. And I'm speaking to a mother with young children.
Lots of young children.
That's right, so I'm taking advantage of her here. But I say this to people all the time. Mary Kay Ash, who founded Mary Kay Cosmetics, used to say there are 4 priorities in life. If you get them out of order, it's only a matter of time before you're in trouble. God, call it what you will, God, self, family, work, right? I say to young mothers all the time, okay, is self on the list? Is self on the piece?
On the list.
Right? Is self on the piece of paper? Is self even on the back of the piece of paper? No, right? If you, as a human being, are not going to take care of yourself, you are going to teach your children not to take care of themselves.
This is a very, very powerful wild card to play with mothers.
It's true. And all of them go, oh, you're right. So
what are you teaching your girl? I love saying that to mothers of girls and boys. What kind of woman are you teaching your son to marry?
That's right.
And what kind of woman are you teaching your girls to be?
Exactly.
Oh, really? It's such an unfair question, though.
Well, and when couples come to see me and they're frustrated with each other, I go, okay, are there kids? If you can't do this for you, if you can't straighten this out and figure out a working way to be comfortable together, great, then divorce. Otherwise, you are setting up your children for unhappy marriages. Why would you do that? So I talk to couples, I talk to individuals, I talk to people with kids and who bring their kids sometimes, who are worried about their kids, don't know what to do. Can we help with this? Can we help with that? I had a couple come once. They were worried about their 5-year-old boy who had taken to carrying a purse, right? Oh my God, the gender thing.
Did he have 3 other sisters?
No, he had young twin sisters, younger, and he wanted some attention. I said to the dad, get over it. I said, listen, you go to TJ Maxx, you buy your own, and I guarantee you in 3 weeks that boy will put the purse down. The dad said to me, you're kidding. I said, no. I said, if he doesn't, I'll buy the purse from you.
Buy a nice one.
Right. I got the phone call from the dad 3 weeks later. You were exactly right. He put it down. I said, all you had to say was yes, Dad. And you know, Wendie, that's really the truth. That's my job, is to say to somebody, yes, you're having your experience. Do you want to keep it the way it is, or do you want to change it? If you want to change it, we can change it anytime you like. But yes, you're having this experience.
You're having what you're having.
That's right. Instead of being, human beings are really funny, you know. We don't not do things very well, right? Whatever you do, don't think about the Statue of Liberty.
There she is.
Right. Faster than fast, right? Instead, we need to be doing things, not doing things, right?
Yeah.
That's why nobody ever leaves a time with me without a plan of action. What do I have to do in order to make the changes that I want? Not what I want them to make, what do they want to make? What actions will make this different? Because actions are what change things.
So when you're talking about actions, are you also looking at what thoughts are people, so you mentioned earlier thoughts drive feelings. So when you're talking about actions, are you looking at what thoughts are people having, what actions are people taking? Is an action considered a thought to you? That's really sort of what I'm getting at.
No, but thoughts that defeat action are not skillful or useful, right? Oh, why am I even bothering? Why am I counting calories? Why am those, right?
Noise.
Well, how about the thoughts that go to support you in this? I choose to be healthy. I choose to dance at my kid's wedding. I choose to hold my grandbabies. And a lot of the time, the patients I work with, we look for the thoughts that are defeating the changes that they want to make, right? So people say to me, oh, I can't make myself go to the gym. I go, don't go to the gym. Walk out the front door, right? You don't like to go to the gym, don't go to the gym. It's like, for a long time I taught people how to meditate, and people would say to me, I can't hold still. I'd go, don't. What do you mean? Don't. Walk and meditate. Use a mantra. Don't hold still, I can't make my thoughts stop. No, are you Mr. Data? Do you have an off switch? Nobody can make their thoughts stop. What you do is you get under them, right? So
what do you mean by that?
I tend to visualize it like a ticker tape. Like, let my
well,
thoughts.
You have one.
Right, let them go by. Let them go by. Having a thought. What am I going to have for dinner? Am I going to get home in time? Am I going to get caught in traffic? Am I dead? Ay. If you get involved in that, you're tired all the time, right? Just let it go. Chatter. That's fine. But then inside you, in between the in-breath and the out-breath, there is a quiet, still, peaceful place that everybody has access to, that costs nothing.
Free.
You don't have to go anywhere. You don't have to do anything, because the last time I checked, you were still breathing, right? The minute, actually, I learned this from you. Your out breath is longer than your in breath. You're going toward calm, right? Breathe out. Just consciously breathe out.
That
right?
activates your restful relaxation, digestive rejuvenation. Parasympathetic is the medical term, but
I do it all the time,
stuff.
right? I say to people, okay, breathe. You say to somebody, breathe. What do? They go,
right.
No. Breathe out.
The other way.
Right.
Breathe right.
Right. Aurora Borealis. I say, be the north wind. All kids can do that, right? The people in my office. Be the north wind, right? Well, the idea also is, so often when we deal with health, we deal with life and death, we deal with dire things, my God, Angelina Jolie and the breast cancer gene, and a double radical mastectomy, and oh my God. I had 3 women in my office that week freaked out about their genetic profiles, and I said, well, wait. First, let's think about this. You can have a test to find out if you have that gene. So instead of spending your time scaring yourself, call your doctor and get the test.
Get your blood drawn.
Right? This is not complicated. Even I know that. So the long and the short of it is, if I am saying to people, well, wait, there's a bigger place. You don't have to be so scared. This is not the be-all for now. Yeah. This is not the be-all and the end-all. And one of the other things I think that I consistently do with people is I clear out their human energy system. Now, I know
What does this mean?
Yeah, I know that sounds complicated. So
And we're coming up on the end of our conversation,
Okay.
so I want to make sure we do justice to this.
Okay, so the human energy system is based in light, okay, like a rainbow. And everybody has an aura. You can tell if you take your own hand and go like this. You can actually feel energy. Yeah, from your own palm, right? That's actually called a chakra, but we can do that another time, right? So, okay. People collect static in their field. You know, you're driving and somebody cuts you off and it, right?
Yeah.
That stays in your field. If you don't know how to clear that, clean it up.
Which most of us probably don't.
Most people don't, right? When they come to see me, people leave me and they feel calmer because I just brush it off.
Not physically. It's
no.
not like you're taking a broom and you're sweeping
No. But psychically, as people are telling me their stories, I'm looking at their body energy. I'm seeing what's happening. I'm seeing what's shut down, what's wide open, what the problems are. I go, do you have an upset stomach a lot of the time with some people? Or are you frightened a lot of the time? Or do you find that you get a sore throat a lot? You know, it just, people block their energy in different places. They have different weak spots, you know. In my own energy system, the weak spot is my third eye because the weak spot is actually
to touch your third eye, right?
my eyes.
Yes.
Right? Oh, sorry about that. But I use my eyes and my own third eye all the time because I use my intuition all the time, every single day. Now, the one thing that I would love to leave your audience with is this. If you are intuitive, you can learn how to use it. You can learn how to use it. There are people who teach this, right? There are books about it. You can learn how to use it. You can get good at it.
And you don't have to shut up.
No, you don't have to shut up, really. And it also doesn't have to be about bad stuff. I mean, I get wonderful flashes about good things now that I know that I can turn it off. So that if I run into Wendie Trubow at Whole Foods, I just say, hi, Wendie, and I'm not looking at her energy, right?
Right. No free reads.
No, because that's immoral. When I sit in contract with a person, I'm working for them and I'm exchanging energy and they're showing themselves to me in a way that, you know, I wouldn't expose them in Whole Foods, right? Or myself. So as I got older, I learned how to cloak myself and not be readable and not read other people.
Right. That's not fair.
It's not fair, it's not right, and it's immoral, and that's not good for me. So the cool thing about this, as far as I'm concerned, is that my job is to set people free to be more who they are in their own bodies, in their own awareness of themselves, in their own consciousness, in their own excitement about their lives and joy and fun and a good time.
So you have 3 offices, correct?
I do.
You work in Somerville.
I do.
You work in Wellesley, and you work in Dedham.
I do, and I'm sure when Visions opens another place, I'll work in that place too.
Got it. Susan, it's been a pleasure talking to you today. I'm so grateful for what you've shared and the light you've shed on, how to be healthful and spiritual together.
Thank you, Wendie. It was a lot of fun. Anytime.
All right. Thank you for watching Visions for Health. We'll see you again soon.